Hello, hello. Thank you so much for coming in today. I appreciate that. I see that you are scheduled for a cranial nerve exam. Okay, perfect, perfect. I would like to thank you for coming into the neurological office. I am Dr. Hitt, and I will be taking care of you today. So, I do have your form here. So, looking at your history, I see that you had a bit of an accident. Got into an accident and hit your head pretty hard. Okay, so I know that you are coming off that injury very recently. So if things aren't too, how can I say, they aren't perfect today, don't you worry. I know that you're still healing and everything is going to be okay. All right, so let's see. I do see here that from your last doctor's visit, that the last doctor was concerned a bit with your memory. Have you been having any kind of memory issues? Okay. Gotcha. Okay, so let me just go ahead and get my gloves on. And if you will, please move forward for me. Yeah, just get right on the edge of the seat. Yeah, just like that. And could you just square up with me? Thank you. All right. Okay, so to begin this examination today, what I will be doing is I'm going to show you just a few things, and I would like to see if at the end of the examination if you can remember them. Okay, they're not very difficult, they're very simple things. Okay, so okay. There we are. Gloves give me a little bit of trouble. Sometimes they do, sometimes they don't, but okay. So, are you ready? Okay, so here is the first thing that I would like you to remember. Yes, it's a banana. Okay, we have a banana, a robot, and a rabbit. A banana, a robot, and a rabbit. Now, you don't have to remember them in that order, but I would like you to remember these three things, okay? Good. I'll be asking you at the end of the examination. All right. So, I'm going to go ahead and take a quick look at your ears really quickly just to see how they are. I did see on the chart that your injury is somewhere near it. Okay, so if I do cause any kind of pain, please let me know, okay? And I will stop. See the injury. I'm gonna go ahead and okay, what happened here? There we go. to go ahead and take a look at this side as well, just to see if there's any kind of major differences with each different side. Tell me that obviously you're gonna have a bit of a scar, but has it been feeling a little bit itchy, maybe a little bit of a pulsing feeling, anything like that? Okay, got it. Okay. All right, cool. Good. All right, so I'm just gonna go ahead and check your temperature. Have you been feeling a little bit ill or anything of that sort lately? Okay, so let's go ahead and check your temperature really quickly. If you remain still, please. There we go. Okay. And let's go ahead and test that one more time. Okay. There we go. Okay. Good. Excellent. All right. Okay. I am going to actually begin this examination today by testing out your olfactory sensors. So what I'm going to ask is that just get this open here. There we go. Okay. Yeah, basically I'm just gonna test your sense of taste. So I'm just gonna ask that you go ahead and let me know what flavor this is or what flavor it is to you. Okay. Okay, so here's going to be your first one. Okay. There you go. And what is that one to you? Very good. It is orange or tangerine. Somewhere in that citrusy family. Yeah. Okay. And here is your next one. Okay. Here we go. There you are. Good. That should be enough. And that one. Very good. That one is blueberry. And now for the last one, okay? Now, seeing as you got the other two correct, this last one isn't 100% necessary for you to get correctly. I really just need you to be able to identify at least 2 out of the 3. So, we're just going to go ahead and do this last one because we already had it ready. Okay, so let's go ahead and give you a little bit of this one. Here you go. Very good. And what is that one? Okay, that's okay. That's okay. No, you didn't get it right, but I know you want to know what it is. So this one was broccoli. Okay, it was broccoli. Okay. So but otherwise you did very good. Here we go. Perfect. Alright, so I'm actually going to go ahead and take a quick look at your eyes. I want to make sure that everything is working properly there. Are you having any difficulty seeing, whether that is from up close, from far away, or maybe even focusing on maybe I guess specific letters when if you're reading? Okay. What about anything to do with light, such as when you turn the light on in the morning after waking up, or maybe if you work in front of a computer, or if you're looking at your phone? Yeah, like watching YouTube videos, things of that sort affect your eyes. Okay, and what about maybe the sunlight? Okay. Okay, good to know, good to know. Alright, so I'm going to ask that you please go ahead and I'm going to shine this light directly into your eyes, and I'm just going to ask that you please look at the light, okay? Alright, very good. So you're going to look right here. I'm going to keep my finger right about there so you know to look right here, okay? So go ahead and look right here for me. Very good. Very good. Perfect. 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 Look. There you go. There you go. Now you're looking at it. Okay. Can you please bring your attention? Please bring your attention to my fingers. Yep, I want you to look at my fingers right now. Very good. Very good. And now look at the light. Good. And now look at my fingers. And now look at the light again. Very good job. Now, could you please look straight ahead, okay? So, I would like you to look right about here, okay? Yeah, very good. Very good, yeah. Good job. Good, good. That's it. And now, could you please look to your left? Good job. Good, good. And now, can you please look to your right? Good. And look straight up for me. Interesting, interesting. And good. Now look right back at the light. Good. Good. Very good. Perfect. Good. And let's go ahead and take a look at this side as well. Once again, I want you to start out by looking directly into the light. Okay? Yep, you're looking right here. Right here for me. Good job. Good. Very good. Perfect. Good. And okay. And if you will, please look right over here. Look at my fingers. Very good job. Good. And now look at the light, please. Okay. And now look at my fingers. And now look at the light. And now look at my fingers. Good job. Good job. Okay, so let's go back to the light for me. want you to look straight ahead, okay? Very good, very good. All right, from there, can you please look directly to your left? Very good. And now look to your right. Good job, good. And now, can you please look straight up? Very good. And now, look directly into the light. Good, good. Okay, perfect. Excellent job, excellent job. You can go ahead and relax for just a second. Have you been having any kind of trouble, I suppose, seeing really low in your peripheral vision? Okay. Before I do that, I'm going to go ahead and do a couple things just to see how your peripheral vision is, and then we'll move into the exact same thing but with the light. So right now, if you will please, I want you to focus on my nose, or better said, directly in front of you. I want you not to move your head. I only want you from this side or to that side. Okay, so you're gonna look right here. Very good. So just let me know when my finger is no longer visible to you. Okay, so here we are. Very good. Excellent, excellent. Good job. Very good, very good. Okay, so I would actually like it if you covered your left eye. Good job. And go ahead and look at me straight ahead. Good. And you're going to do the exact same thing right now. Good. Good. Good job. Good. Very good, very good. You can go ahead and switch for me now. Very good. Good. Good job, good job. Now, open, you can have both of them open right now. Okay, good. Look right about here. So I want you looking as low as you possibly can. So right about here, okay? Okay, good. I'll keep my hand here for you, okay? So you have something to look at. Hold on. There you go. There you go. That might be a little better since it has some color. Okay, so I want you to look at the pen, okay? Now, can you see my fingers? Can you see them? Okay, good. And now, what about on this side? Can you see them now? Okay, good job, good job. Now, I want you to look up. I want you with your eyes, not with your head, just with your eyes. I want you to look up. Very good. So, I'm going to start out with this pen. Okay, I'm going to start with this pen right about here for you. And you can see it, correct? Okay, good. I'm going to start with this pen right about here, and I want you to let me know when you can no longer see the pen. Okay? Okay, good. And we're going to go ahead now and do it individually, so please cover your left eye. Okay, good. And now we're going to do the exact same thing. Okay, so you're looking straight up, and let me know when you can't see the pen anymore. Good, very good job. And now please switch. Good. And once again, we start right about here. You can see it, right? Okay, good. And let's go ahead and begin. Good. Very good job. Excellent, excellent. You can relax for a second. Okay, so let me go ahead and utilize this pen light. And what I'm going to ask is that we do the exact same thing we were just doing. Okay, so we're going to start out just by doing it individually. So I want you to start out by closing your left eye. Good. And you're just going to let me know when you can't see the light anymore, okay? Very good. Very good. Good job. Very good, very good. Now let's go ahead and switch. Good job. And same thing. Okay. Very good. Very good. Perfect. Very good, very good. Now, same as we were doing before, I want you to look straight up. So, we start out by covering your left eye. Good. And you can see the light from right about here, right? Okay. So, you just let me know when you can't see it anymore. And now switch. Good. And you can see the light here. From here you can see the light. No? What about there? Okay. Alright, so here we go. Good job. Good, good, good. You can go ahead and relax once again. Okay, so I want to see how your light tracking is. So let me actually switch this. There we go. And what I'm going to ask you to do is you're just going to follow the light, okay? You're going to follow the light only with your eyes. So your head, I want it just fixed, looking straight ahead, okay? Very good, very good. So, here we go. You ready? Okay. So, please remember, you're only looking at the light with your eyes. So just follow the light. That's it. Very good. You're just following this light. Very good. Very good. Good. You're doing really well. You're doing really well. Good job. Very good. Light. That's it. You're doing really good. Very good. Very good. Good, good. Okay, you can relax. Okay. So, I do have a couple more flashcards like I showed you earlier, but this time, it's gonna be more of recognition of certain things, just to make sure that your brain is functioning correctly, okay? If you have any trouble, please let me know, okay? So, we're gonna go ahead and start out with this one. What do you see in this picture? Very good, very good. And now, very good. It is a carrot. Okay, we've got two more. Okay, so what do you see in this one? Very good. It is a car. Okay. And last one. What do you see here? Very good. It is a telephone. It is a telephone. So, what I would like you to do with this telephone is I'm going to bring it pretty close to you. And what I'm going to ask you to do is close your left eye. So, good. And can you please focus on this number right here? The number 2, yes. Good. Now, what I'm going to ask is, can you please just keep looking at it and just let me know when you can no longer see it clearly, okay? Alright, I'm going to keep going a little further. Right about there. Okay. So, what I'm going to ask you to do now is tell me, what do you see? What figure, what shape, what color, what anything, what do you see where the number 2 is to you? What do you see there? Alright. Okay. Okay. Alright, so now I want you to switch. You're going to cover your right eye now. And I'm going to show you once again. I'm going to show you right here. We're going to go ahead and let's focus on the number 4. So you can see it correctly. Okay, good. And now I'm going to back it up and we're going to do the same thing. So you let me know when you can't see it anymore. Okay, I'm gonna go a little further. Right about there. And now what you're going to do is you're gonna let me know what shape, color, things of that sort. What can you see? Okay. All right. That's okay. You can relax now. All right. The reason I asked, the reason for that is just to make sure that your brain is working, to make sure that it's trying to figure out and decipher what it's looking at, even if the object is difficult to see. Okay? So in reality, there is no right or wrong answer of what you can see, just as long as there is something that you can see, whether it's a color, maybe just a line, a dash, a slash, whatever it may be. Okay. Very good. Okay. So, if you will allow me, please, I'm going to go ahead and take a look at your ears, okay? So I'm just going to ask that you please just look straight ahead and try not to move, all right? Thank you. Okay. Very good. Perfect. Perfect. Very nice. Very good, very good. Nothing out of the ordinary there. Okay. Just move this right over here. And let me go ahead and take a look at this side as well. Perfect. Very nice. Excellent, excellent. The ears seem to be in perfect shape. Very good. Very good. Okay. Here we are. Okay, so I'm just gonna go ahead and give you a couple words, both on each side, and I just need you to repeat them back to me. These words are completely random, so if you feel the urge to need to laugh, you can go ahead and laugh. There's no problem, okay? Alright, so I'm gonna bring it in this side, and you just repeat the word back to me when I ask you to, okay? Reflect, reflect, reflect. Go ahead and tell me. Okay, good. Let's go on this side. Plastic, plastic, plastic. That time. Good, very good. Pop, 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 pop. And that time. Very good. One more on this side. Okay, and that's it. Perfect. 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 Okay, and how about that time? Good job, good job. Excellent. Okay, so I'm going to just create a couple sounds, nothing too crazy, okay? So, and you just need to let me know on what side you heard it on. So right now, I do ask that you please go ahead and close your eyes. Very good. And I just need you to listen, that's all, okay? So you're just gonna let me know either left or right, okay? Okay. Good job. Good. Good. Very good, very good. Good job, good job. Very good. Good job. Very good, very good. And now we're going to use a tuning fork. We're only going to be using one today. Usually during these examinations we have multiple at different decibel ranges, but we're just going to be using the one. This is a pretty standard one, so you should not have any problem hearing it. Okay, so you're just going to let me know when you can hear it. Okay. Very good, very good. And please let me know when you cannot hear it anymore. Good job, good. And let's go ahead and use the other side as well. Good, very good. And let me know when you cannot hear it anymore. Excellent, 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 excellent. Okay. Very good job, very good job. So, I'm going to ask now that you please, or if you can, please remember the things that I asked you to remember at the beginning of this examination. I showed you 3 cards. Can you remember them? Okay. Okay. Very good. Let me just write that down. Okay. All right. So, just so that you can obviously see what they were, here's one of them. It was rabbit. Another one, a banana, and another one, a robot. These were the cards that I asked you to remember. Did you remember them correctly? Okay, so that does conclude today's examination. I know that it wasn't a very detailed examination in terms of for a cranial nerve, but since we knew what exactly was going on with you, it was just a bit of problems with your memory. That's why it was a much more focused examination on certain things. So, I would like to see you come back in about 2 weeks or so, okay? And in about 2 weeks, we can give you a more in-depth cranial nerve just to see how everything in general is progressing with your recovery, okay? Okay, perfect. So please make sure that you do take care of that injury. Okay, try to take it easy. Try to make sure you get some good rest, all right? But until next time, I am Dr. Hit, and it was a pleasure taking care of you.